We wish you well.
Good deal. Thank you.
Kim, over to you in the health center.
From the health center this morning, we're talking about balloon sinuplasty. Dr. Madan Kandula from Wheaton Franciscan Healthcare, St. Joe's, joins us this morning. Basically, we're talking about sinus infections and people who have chronic inflammation.
Absolutely. Yeah, and the balloon sinuplasty is the first new option in 20 years for people like that.
And that's amazing.
Yes,
that's 20 years.
It really is.
And before, people either had surgery as an option, maybe antibiotics.
Right. The balloon sinuplasty, where that works best, is for people who've had recurrent infections but haven't been candidates for traditional surgery. And it sort of kind of hits the middle there for those people.
Let's take a look at some images that you brought along, and we're going to see exactly what the procedure involves. What is this that we're seeing?
What you're seeing on the left is actually the first thing we do in the surgery, which is introduce a wire into one of the sinuses, and then we place a balloon over that wire into the sinus opening. It's actually the natural sinus opening, and then we inflate that. And we're doing that all under radiographic imaging, so we're able to see exactly where we are in the sinuses. And as you can see on that rightmost picture there, when we open things up, the infection and inflammation is able to come out, and that creates a major difference for people.
And we've got some images also of the tools that you use to do this.
Yeah, and that's it. It's really very, very similar to what is currently used for angioplasty. So same concept in the heart vessels, and exact same thing. The wire and the balloon are shown there, and that's when the balloon is inflated. That's what that's showing.
And you're talking about your face, and my concern would be, is there scarring?
No, this is the best thing with this is there's no scarring, there's minimal bleeding. It's a very, very easy recovery, which is a dramatic difference from what we've had available prior to now.
And I know that people every year, some people like clockwork, they get these sinus infections, and it puts them down for weeks.
Right.
And in fact, sinus infections send more people to the doctor than hypertension?
Mm-hmm. Yeah, about 37 million people in America are suffering from this, so more than 1 out of every 10 people in the country. And like I said, up until now, there weren't a whole lot of great options. This is an option for some, and there certainly are going to be people who need traditional surgery, but this opens up a lot of relief for a lot of people.
Speaking of people who may not be eligible for this, I would imagine that people that maybe have breathing difficulties already, the sleep apneas, they probably would not.
Right. Up till now, I've actually been using this in combination with other procedures for people just like that. So
really?
There are people who, the people who really aren't great candidates are people who have polyps, which are sort of fleshy tissues in the nose that block things up. Other than that, it tends to work really, really well for people who are having recurrent infections or chronic infections.
And finally, the pain factor after this procedure, what is that like?
It's really relatively almost non-existent, which is remarkable. People are back to work the next day. It's really amazing. Really?
Mm-hmm. And then the results, what do they tell you afterwards?
They say it was, very, very easy, sort of like going to the dentist. You are under anesthesia, so there's the recovery from that. But beyond that, it's very little bleeding, very little discomfort.
I'm all for that. Dr. Kandula, thank you for being here this morning.
Thank you.
And for more information about sinus angioplasty, is that it?
Sinuplasty.
Sinuplasty. There you go. You can always call and find out more information. You can log onto our website and we'll have info. 827. Well, it's been anything but a boring summer for the American Idol judges. We'll hear from Randy, Simon, and Paula on what they've been doing since last May. Stay with us. We'll be back right after this.
You're watching Fox 6 Wake Up News with Mark Concannon, Kim Murphy, Nicole Coughlin, and meteorologist Rob Haswell. Fox 6 News, the most powerful name in local news.